Welcome back to season 2 of Authentically Peculiar with Marcia. I am your host, Marcia Blaine, a licensed professional counselor, a clinical hypnotherapist, an author, motivator, and life coach. Join us during this season as we begin to normalize freedom. Authentically Peculiar with Marcia.
Welcome back to Authentically Peculiar with Marcia. I am so excited to bring the topic that we're bringing in this health segment of this season 2. Today, I'm going to be talking to Dr. Catina Greene and Janice Leonard, which is an LPC, as we discuss HSV. What is that? Herpes simplex virus. You guessed it. Give me a second. Let me read their bios and then we're going to rock and roll. So, Dr. Catina Greene is a dual certified mental health nurse practitioner and a board certified family nurse practitioner. And for the past 25 years, Dr. Greene has provided compassionate nursing care to individuals from birth to the end of life. Her educational background consists of Bachelor of Nursing from North Carolina Central University, as well as master's degree with postmaster's certificate and doctorate degree from Frontier Nursing University. With the understanding that mental health is just as important as heart health, Dr. Greene strives to care for the whole person and utilizes her expertise in medication management to supplement as needed. Dr. Greene partners with her clients to explore experience physical and psychological responses. These responses may be related to complex life changes, traumatic events, chemical imbalances, or thought processes. She then incorporates the client's experience with her expertise and evidence based practice to provide an individualized plan of care for each client. That's the authentic part of being peculiar. I'm just saying. Being a military veteran of 11 years, Dr. Greene has special interests in veterans, young professionals, undeserved populations, and persons going through transitions in life. She desires to serve a diverse community and ensuring a safe place for all, growing her practice with all ages, races, religions, and genders. So, welcome aboard, Dr. Greene.
Thank you. Thank you.
You're so welcome. Janice Leonard is the founder and licensed professional counselor with Cognitive Shifts Psychotherapy Private Practice. She is also the creative director and host of Her Sexual Space podcast. Janice began her career in business and marketing management at Grambling State University and then answered her calling, studying counseling psychology at Colorado Christian University. Janice is now on the path to becoming an ASEX certified sex therapist through Sexual Health Alliance. Through her work with women, partners, and couples, she has identified a great need for psychoeducation and healing work on the basis of mental and sexual health. She helps her clients learn what pleasure means to them. Yes, and amen. Understanding how their minds and bodies work together and deconstructing messages that conflict with the way they attend to their bodies, particularly in Black and Brown communities. In addition to managing her private practice and caseload, her podcast, Her Sexual Space, is carefully designed to create a space to facilitate dialogues on women's sexual health. Her sexuality inclusive and sex positive approach is highlighted episode after episode. Janice Leonard has strategically combined her passion for mental health, sexual health, women, connection, and community. Welcome aboard, Janice. It's so great to have you all here with me today. I'm super
Yes.
Yeah,
excited
thank you.
about what we are going to achieve here in educating the individuals throughout the world. My goal is to make this a world podcast because it's so little talked about. Before we get started with questions, do either of you have anything to say?
I'm ready to have fun.
Let's have some fun. All right. So, I wanted to do this a couple of ways. I wanted us to get the medical understanding of HSV 1 and 2, the
Mhm.
likelihood of being diagnosed with HSV, and then we're going to roll into living and understanding how we as therapists can help clients processing it, their sexual understanding of HSV, and then who knows what pops up from here. So, Dr. Catina, I'm going to start with you. Can you
Yes.
give us,
Well, I do believe common things occur commonly,
whew, I like
and
that.
we are more alike than we know.
Yes.
So when we zone into herpes,
Mm-hmm,
living with herpes,
mm-hmm.
um, and you mentioned herpes simplex virus 1 and type 2.
Yes.
So everybody knows about a fever blister,
Mm-hmm,
right? Everybody knows about fever blister. And, grandma might have said, oh, that was some bad fish. Or
mm-hmm,
somebody might say, oh, you got fever. But reality is that's herpes simplex 1.
mm-hmm,
And many people never go to the doctor about it.
mm-hmm.
Many people live with fever blisters that come and go throughout their life and don't think anything of it. But reality is that is herpes simplex 1. Okay.
Okay.
So then we have herpes simplex 2.
Mm-hmm,
That one originates in the genital area.
mm-hmm.
Okay, that one does originate in the genital area. But we can have lesions from type 1 in the genital area also. How does that happen?
Yes.
Well, we all know about different sexual modalities
Mm-hmm.
and oral and genital combinations.
Very
So
true.
let's all be honest. So, oral satisfaction does cross these barriers. Okay.
Okay.
So sometimes, we can't take those things for granted. We cannot talk about herpes simplex 2 without talking about 1.
Okay.
Okay. So the funny thing is when a lot of times people are exposed to herpes simplex 1, which is a virus. It
Mm-hmm.
is a virus. It is a cousin to chickenpox, right? Nobody looks
Okay.
at chickenpox in a negative way.
Right.
So a lot of time children are exposed to herpes simplex virus number 1 as children.
Mm, okay.
That's so as we go on in the with talking, so oftentimes the first exposure is either very mild or it can be the worst exposure. It could be the
It's kind of
worst.
like when people say, um, don't be kissing these babies. We don't know where your mouth's been. Okay.
Right.
Okay.
Yes, surely. So as children, they're exposed to the SPV virus, but it's also a protective mechanism. Studies show that people who have those antibodies circulating in their system can have a lighter experience with herpes simplex 2 if they have an exposure.
Oh, okay.
So it's almost a protective. So yeah, we cannot decide as children if we're going to be exposed to viruses. So that is important. So that is something. These viruses stay dormant in our system. They go and they hide in our nervous system and then are triggered by various events in our life.
Okay.
Um, so some people are triggered by stressful events, some people sunburns, chemical agents, very what am I trying to say? Like pineapple, what acidic fruit,
Okay. Okay. Mm-hmm.
different. It can all of those things can be different triggers for people. Okay. So in both of our areas.
Mm-hmm.
So Did we go through that one? Is this for prevalence in our community? So again, common things occur commonly. So if I were to tell you that 18.6 million people are walking around us with this virus. So we're going to cluster them together now that we do know they're separate, but we're going to also cluster them, right? 18.6 million people are walking around. The last study that was performed, there was a 582 new diagnoses
Like daily?
documented. No, not daily, in
Oh,
2021. So
gotcha.
usually the studies be like a year long. So in 2021, there was 582,000 new diagnoses,
My goodness.
right? And most of those were women. But is that a fair assumption though? Women are more likely to go to the doctor. Women are more astute to their bodily changes, right? Men, if they aren't dying or burning, it's hard to get them to go to the doctor.
Yeah, that's a really true statement because most of my clients said that the person that they were with knew they had HSV, passed it. Well, they knew after they passed it because they had the hair bump or something of that
Hair
nature.
bump.
Mm-hmm.
Mm-hmm. Hair
And
bump.
so I can only imagine with 582,000 cases annually, the number of individuals who are infected
Mm,
and what that looks like for them in their mental health of who
right.
they are and their self-esteem and things that nature. Janice, tell me this question. When you have clients coming in, and Dr. Catina, I'm going to come back because I know you still got a plethora of information to share with
Oh
us.
no.
So, Janice, you heard Dr. Catina share just the beginning process of HSV and the difference between HSV1 and HSV2 and how it passes. And I'm going to go back to Dr. Catina, but I wanted to ask you in your practice, when clients come in after the diagnosis, what are some things that you share with them about just processing being diagnosed with HSV 1 or 2?
Okay, thank you so much. That is a really good question. So it's interesting that clients don't often come in right after they receive the diagnosis. Oftentimes, when I've met with a client, it's a year, 6 months to a year later, sometimes 2 years later. And it might be because of secondary stressors as a result of the diagnosis. So they might have issues dating. Usually it sounds like the virus is typically under control. They've either gone the medication route or they have done some lifestyle changes to manage the symptoms. But oftentimes when they come in, it's because they're having difficulty disclosing. So that's something we work through. So we talk through the shame and the guilt, and we go, we discuss, having the virus doesn't immediately eliminate you from having an amazing life, right? So we talk about what beliefs are we holding on to as a result of this diagnosis. Certainly, I mean, our genitals are not the only valuable thing that we bring to relationships and a healthy life in general. So we talk through that. The shame and guilt part, that takes a few sessions because they have held on and maintained the beliefs that I am not good enough, I'm a bad person. They feel so much guilt for not doing their homework or asking better questions before getting into that intimate situation, if that's how it was presented. But also, we talk about, just low self-esteem because it feels like a gut punch to your self-esteem, depending on where you are in life when you receive it, right? So it's definitely a huge stressor, but it takes a couple of sessions to really get clients to a place where they feel confident enough to go back into the world and, deal with the rejection that might come with it, because that's also an interesting aspect. If rejection is something hard for you, that's something that we have to include in our treatment plan. How do we, have that autonomy for ourselves, but allow it for others to say, okay, well, maybe this is a little bit complicated. And of course, the HSV virus, it is a complicated virus. It's
Oh
not
yeah,
black and
listening
white.
to what Dr. Katina was sharing,
Yeah,
I'm sitting here blown away. I'm gonna go back to Dr. Katina real quick.
yeah, yeah.
You shared with us some statistics, but I need you to break it down to the lowest level where people can really see how this
Okay.
can affect their lives and how frequently it could, the potential
Okay.
there.
So as I'm looking at the top of the screen, there's 3 of us here.
Yes.
So we added one more person to the top of our screen. We had 4 people at this round table. One of us, at least one of us, I could bet would have HPV.
HSV.
Yes. Oh, yeah, because we was talking about HPV.
Well, we went on the
Right.
HPV for a minute.
So yes, herpes simplex virus, at least 1 out of the 4. So
That,
here's the thing. And it's like that number has been around over 20 years. So
So it
think
has
about
to
it.
be
Over
some kind of change, either increase or
that math
decrease,
ain't
right?
mathing. It's more prevalent. It is
Wow.
definitely more prevalent now. And so, like I said, common things occur commonly. This is something that is in our system at this point. Um, I don't want to get ahead of you, but then you say, well, why are the numbers hiding? We
Mm-hmm.
did talk about why that a lot of times men don't go to see the doctor. You had
Right.
mentioned the hair bump. They are famous for having a hair bump that just come and go away. Then they can be a little rough cut. It may not be as tender to them, but us lady parts are very fragile.
Right.
So a hair bump on a lady part is going to stand out. Right.
Right.
So we
Right.
notice everything on the lady parts, but the guy parts, maybe not so much.
Mm-hmm.
So then you look at so identification. What if a person had their initial breakout when they were younger, less experienced, less knowledgeable? And what if it was minor? We also talked about if a child had a childhood exposure of
Mm-hmm.
HPV-1, and then they had an exposure to HPV-2, they had some antibodies in their system. What if they had a mild experience? They still wouldn't know that they had it, right? So then there's layers and layers. Some people will not have another exposure for years and years.
Okay.
Some
But it could
people,
be stress induced for the frequency of exposures, right?
so when you're talking about triggers, that is, you look at that, but some people don't have subsequent episodes.
Gotcha. Okay.
I think that I saw one stat. So in one stat, it was like when they followed people over a year, 50% of people did not have a reoccurrence. Yes, 50% of people with they did not have a reoccurrence
Okay.
over that time period. Okay. Um, and then so they were breaking down to, and then so you can have one subset of people who, from their initial outbreak,
Mm-hmm.
may never have another experience. Then
Wow.
you have another subset of people who may have quarterly outbreaks. They have an outbreak every 6 a year, 10 a year.
Okay.
So those are the people who we can more identify triggers with. But for those people who have isolated episodes,
Mm-hmm.
they're easier to track and they fall through the cracks. These
Okay.
people that you guys probably have coming into your clinic are people who had a distressing moment, whether it was a bad outbreak, whether it was, obviously it was enough to get their attention, right? It caused
Mm-hmm.
anxiety, made them worry. So those people are going to be your more, they were more traumatized by their experience.
Okay. I got you.
Okay.
Okay.
But it's a whole subset of people who are walking around with it and they had one episode or one episode every 5 years.
And so that brings up a good question, Janice. When you think about it, because, and I'm gonna tap into the sexual therapist side of it as well as Dr. Catina, when you're talking about the reduction of flare-ups and putting your body into motion, right, by whatever the processes are to, and I'm sure you ladies are going to be able to explain what those processes are to really try to reduce flare-ups. Can you all share that with us? What do I need to do to reduce some of the flare-ups?
Yeah, and once again, this is why I think this virus is the most complicated at all, because of a flare-up for one person and a flare-up for another person might look totally different. Some have symptoms, some have no symptoms. They have no idea there's any changes going on. So I do think it's important to consider the antiviral medicine. It definitely suppresses the flare-ups and frequencies of flare-ups. Also, I think there are some topical creams and things they can use when they're experiencing an outbreak. Also, just maintaining a healthy lifestyle. Of course, any stress relieving activities, we ask them to engage with other parts of themselves, right? We explore, where they have additional stressors. So it might be they might have some relationship issues, they may have some family issues, some work issues, they might explore their own personal goals, consistently building up their self-esteem. But ultimately, there is only so much we can do for flare-ups, right? And the go-to is antiviral, topical creams. So we ask that patients always keep medication on hand. You never know. You might be on vacation and suddenly something happens and you're having a breakout. You're traveling somewhere new, always keeping some medication or prescription. So that's always handy. So they always have that in the sexual toolbox or toolkit, whatever they want to call it. So that's usually what we advise. Also, there are going to be types of sexual activities that you might want to avoid, right? Because as you know, we were talking about this, sex has changed over the years. The types of sex people are having, so it makes sense that now a lot of these things are coming more to the forefront. Certain things that maybe our grandparents were not even doing, we're doing now. There are lots of different
kind
types
of
of
like the
things.
oral practices Dr. Catina was
Yeah.
talking about,
Yeah.
and
So
the
that,
passing on. Because let's face it, some people don't take care of their mouth.
exactly. So we
And
do
so when
encourage.
you are practicing oral
Yeah.
sex, you have to. I always tell people, my clients, listen, if you're gonna do oral sex, get you some Listerine. Start there. Let's try to kill some of the
Yeah.
stuff that's swimming
Medical
around.
and dental. Yes, that has
Yeah,
to be
go
top
to the
priority.
dentist because
Yeah,
you could have different openings that you're not aware of, and
exactly.
then now you're passing on. Dr.
Exactly.
Catina, you said something that sparked my interest. You said we had the antivirals, but when you look at how they are made and the components of it, for the Black community, there's a different strand.
No, that was the other
And
virus
that's
that was.
HPV. Okay, never mind. Confusion. I'll come back. We're going to come
Okay.
back and do the HPV one.
Okay.
And so when you think about the sexual toolkit and bringing in the antiviral cream and different things of that nature and reducing stress, how do you get there though when you're trying to develop partnerships, when you're trying to find someone and having to express to them, listen, I'm not the nasty girl, I'm not the nasty boy, because that's the unfortunate myth around HSV. As you explained, Dr. Catina, you can get it as a kid. It could show up as a cold sore. It could show up. I believe I heard someone say, if you have eczema, that's like a derivative. Maybe I'm wrong. I think I heard that. But correct me if I'm wrong now. Don't let me put no bad information.
No.
So no.
Yeah,
Okay,
no,
got it.
no, not the
Yeah, I don't
eczema.
want to put any bad information out there because I know, which is why I wanted us to have this conversation because I wanted to dispel myths and
Yeah.
untruths, especially that ideology. One of my clients said to me, she said, I didn't ask for this.
Mm.
I found out about it after I had had a traumatic miscarriage. And it is believed that herpes, the diagnosis, had something to do with that. He was aware, she wasn't. And she said, I not just when I have to tell people, I feel like I'm being judged on being either a bad girl or a dirty girl. How can we help them?
So, I mean, that person really needs to unpack what they experienced.
Mm-hmm.
I don't believe that there's any medical provider that could tell her that that's why she had a miscarriage.
Got you. Okay. Okay.
Okay.
Okay.
So, yes, so if she's trying to express that maybe that was her first episode, and a lot of times when people have their first breakout, they can be sicker. They
Mm.
can actually be fluish. They can have fever. They have a more
Yep.
significant outbreak.
Mm-hmm.
Yes, that is true. But when we're thinking, so unless you really could tell me a lot about that
Mm-hmm.
scenario, I would be reluctant to pinpoint that. Could it be in her heart that this stuff is coming down? She has this traumatic event and this traumatic event, and now she's
Mm.
making that connection with her pain?
Yeah, that could be.
I don't know the answer,
Yeah.
but it would be some unpacking. If it
Mm-hmm.
was your traditional, the person had an exposure and they had an outbreak and they were 2 weeks pregnant, uh,
Maybe.
you know, I don't know. I'm
Yeah.
not going to say either way, but I would
Mm-hmm.
literally take that into layers and help her to grow in that place. Okay.
Got you.
Um, but that is a all around trauma, right?
Mm-hmm.
So
Mm-hmm.
of course that would be a vulnerable situation. Um, Pregnancy, birthright, all of those things do come into a play. I will say with this virus, having an open lesion and a vaginal birth, yes,
Mm-hmm.
that is an issue, right?
Got you. Okay.
Contracting the virus in the last trimester, yes, that would be an issue.
Okay.
So, but like I said, all the cards have to be laid out there
Yeah.
together.
Makes sense.
Okay.
Okay.
Yeah. Yeah.
Yeah, thanks so much for breaking that down, because again, I think that we really need to know the medical side of things as well as the mental wellness side of things,
Mm-hmm.
and all of these floating myths
Mhm.
Yeah.
surrounding HSV. Hopefully, this is going to help free some people to really understand. Listen,
Mm-hmm.
you basically can breathe.
Mhm. Right. You
You
don't
can
have
get
to be the poster
HSV.
child. You don't have to be the poster child. I am not the poster child for this condition.
Yeah.
You're not. So you talked
Yeah.
about starting out dating and such. Do we give everybody our medical records when we go on a date?
Mm-mm.
No. All of this is a growing process. Yes, we have to be responsible adults. We
Mm-hmm.
have to be responsible in our sexual
Of
activities,
course.
right?
Right.
Yeah.
So again, there's rules for all people. So if you're out here being irresponsible with your sexual behaviors, that's what you're doing anyway.
Mm-hmm.
And I'm irresponsible and you're irresponsible. Your 1 in 4 done went up pretty high.
Oof.
Okay.
Mm-hmm.
So your 1 in 4 done went up pretty high. So let's
Right.
go ahead and talk about that. Um, you know, like you said, what they call it, a body count,
Yes.
right?
Yes.
So that's what we need, that body count. And so
Mm-hmm.
when you know your body count and you know the network of people you're dating and their body count, come on, let's keep it real.
And I usually just tell clients like this: you and this person were engaged in some type of sexual activity. That person engaged with two other people, so did you. You engaged with two other people, so did they. And it keeps climbing, because for
Oh.
every time they engage, you're engaging in
Right.
a manner, in a silent, ghost like manner, because
Mm-hmm.
whatever's happening. So not only are you connecting to those other physical attributes, you're also connecting to the energy. Intercourse, sexuality, intimacy is energy. It's energy transference. You trying to figure out why you got a bad attitude. Well, you might need to count 5 body levels up to figure out, why all of a sudden something bothers you that never bothered you before. You One of the things, and you all please weigh in on this. I often tell clients, it's okay when you're dating after you've gotten to a certain state to ask those prevalent questions about their clean levels, right? A lot of people, that's going to push them away. Well, would you rather push them away or get infected with something?
Exactly. Yeah, so I can speak to that.
Okay.
And that goes back to the toolkit, right? So when I think of dating with or without an STI, and that's the thing, like, that those should be practices, right? So thinking about your recent STI test, I do encourage clients, and even for myself, even as a married woman, every quarter, every 3 months, I'm doing a full blood work. I'm checking. I'm doing tests, making sure that I am okay. And I think that's absolutely necessary. And with an STI, with or without, once again, we always want to have condoms. There are different types of condoms. You can still have fun with condoms. Dental dams, if oral, all of these things are important to you, you might want to have, different things to protect you in those ways.
And Janice, can you say the last one again? The
dental dams. It's like so it's like a protective covering. You can still get pleasure through it, but it's like a covering.
I feel a little naive.
I know we're a little slow.
So it's a bit of a covering.
So it covers the teeth. If you can explain it, because I know at 55, if I'm feeling a little slow, it may be some other people that won't admit it, but they may be a little slow too about the dental dam. So can you explain that a little more for me?
Yeah, so it's like a clear covering, latex, very much like the material of the condom. You would lay it on top of the genital area, and you continue with the activity that you're doing. It's just a protective barrier. Some people use it, some people don't, but I do think if you're carrying an STI, especially one like HSV2, where once again the symptoms are not always clear. Right. So someone might be shedding and they don't know. Just having those additional tools. And yes, you can opt out of certain activities, but just so that you have these things. And I do think having that discussion as you go on a date, like, let's talk about our sexual health. I think there's so many ways to make it fun and light. But it seems for a lot of people, it's a heavy conversation, which it is so important to know that.
But I think that part of the heaviness of the conversation are the associated stigmas.
Yeah,
right?
For sure.
Because especially in our community, if you ask questions too early about sex, you were labeled as fast, right? So that put a shunning on, especially, females asking questions for sexual clarity or anything. Those are so natural. They should be such a natural conversation to have. No one should be demeaned for having those conversations, because our truth is that moment that your own hand rubs across your body, you're going to get some type of sensation, and you need to ask about what that is. But we make it so taboo. And you mentioned it, Dr. Catina, about the taboos and why we don't have healthy conversations like that. Can you expound on that a little bit?
So I think, like you said, the spontaneity of sexual activity, we have a lot of growth. I think we have a lot of growth. We don't use condoms enough.
Right.
Coming on the medical side, is we don't use condoms enough. We don't. I don't care how much it's been talked about. Condom use is poor. Okay. So I think when we're talking about sexual health and sexual responsibility, I'm like, if this is the playing field, this is the playing field. If you're going to be if you're going to be the one who having responsible conversations, part of it's like, okay, no, I am 100% condom user.
Isn't that, I
Right?
mean, just hearing you say it like that. So, Janice, when you talk to clients about the effectiveness in the use of condoms, and you know the old myth, oh, I can't use them. I like the real feeling. Oh, I can't use condoms. They break me out. All of that. How do you address that, Janice, for with individuals in sex therapy to really shake down that type of thought? Because condoms
Yeah.
come in all kind of shape, feels,
Mhm.
thickness, thinness, the whole 9 yards. So tell us about that.
Yeah, so I definitely encourage it. And I see both sides. I've seen clients who have been really reckless with it. And of
Mm,
course, we might want to explore the diagnosis or what might be leading into that reckless sexual behavior. And I see clients who are completely okay with it. This is something that I do to also protect myself. Because even if you're
mhm,
carrying this, it's also important that your partner is getting tested and we know what they're carrying, right? So I do encourage looking at different types of condoms. There's the ones that feel like skin. There's the one that's, spicy and, colorful and all the fun things. There's so many, but to get people to want to like be excited or want to have fun with it, I think that's usually the challenge because of course, for a lot of people, if you've been in a committed relationship before and you didn't use it, you might know for sure that it feels different. So I do promote different types, different styles, making it fun.
mhm,
So that's the angle that I go with it.
mhm.
Yeah, so that's usually the angle that I go with condoms. But it's always it's heavier when you see clients who are pretty reckless. I've seen clients who have not even disclosed it and they're having reckless sex, and that's definitely an ethical issue. And of course, I come from a lens of, the principles of sexual health, which is unwanted, STIs and pregnancy and HIV and all of the things, but that's something that we always explore a little bit more, like what is making you feel like,
Mhm.
you're invincible or, you're not responsible for your actions. So once
Well,
again,
after that whole 1 in 4,
yeah.
no one's invincible.
Yeah.
Right.
No one's invincible, and we have to
Mhm.
really look at our truth. And I know that when we were younger, we probably were doing all kinds of things out there because we thought we were invincible. But passing STIs is serious
It
because
is.
some STIs create other
Mm-hmm.
biological issues and responses to the body and stuff
Mm-hmm.
like that that's going on. And I know Dr. Catina can fill us in on that,
Yeah.
but one of the things that I wanted us to kind of talk about as well is the ones who are diagnosed and they don't share
Hmm.
diagnosis, but they're intimate. Can
Yeah.
you all do a PSA from your own perspective about the importance of,
Yeah.
I mean, because it's not like HIV. At one time when someone was diagnosed with HIV, or full-blown AIDS, actually, when they were diagnosed with AIDS and they were intentional about having sex with different people, they could literally be charged with a crime. I don't believe
Mhm.
that's the same process for HSV, but
Right.
if you all can enlighten me on it, but why is it so important to overcome your fear of rejection and be truthful with someone about your status?
I'm ashamed of my answer. But I feel I mean, I feel I'm a realist.
Mm-hmm.
Okay. I'm a
Mm-hmm.
realist and I do stand for the side of right, but what
Mm-hmm.
is right? I do not believe I am the poster child for any diagnosis. I believe that you can make conscientious efforts and precautions without um like I met you tonight. Oh, hey, I have HPV.
Oh, no,
No.
no, no, not like that.
No.
I'm talking about someone that you all have decided to get intimate.
Well, here's the
Mm-hmm.
catch. People are having sex so quick now.
That's a valid point.
Here's that's so that's what I'm saying is I'm saying when we are being these philosophical beings, we have to be in the right environment for that.
Yeah.
So when you are you're actively dating for marriage. You are engaged. You're not at the club going home with people. These people are not having these conversations. I'm not judging them.
Right. Right.
I'm not judging them. But this conversation that you introduced may not be for all listeners.
Got you. Okay.
Okay. So therefore, yes, condom use is a different pathway that you have to talk to them,
Mm-hmm.
because you have to talk to who your audience is. So,
Right.
okay, fine. I got you. You're here and you are very aware, you're very conscientious, you know. We're going to have a different talk. But I don't
Mm.
think that that conversation is for everyone. Most of my clients are younger. The dating habits are different than what I felt like you
Yeah.
wanted me to say. The
Right.
answer I would have given you, that's not really what I'm seeing in my day-to-day
So it's
practices.
more
Okay.
old school from my perspective on that sharing. So I get that. That opens that up a little bit more, because we do carry some of our own way back when thoughts
Yeah.
about how
Mm-hmm.
we actually share
Mm-hmm.
those type of situations. So
Yeah.
yeah, that was eye opening. Janice, what's your perspective?
Whew. Yeah, I think, Katina brought up some really interesting points. Dating is so different now. So the way I see it is we have these conversations as we're talking. And once again, even the talking stage is different for people. So when I think
Mm-hmm.
about the talking stage, I'm thinking about, we're talking about values, talking about what's important, what we're looking for,
Right.
our health values, all of the things.
Yes.
But that is not what we're seeing. People are going out and doing it on the first night, or
Yeah.
within days of meeting someone. It's almost like the expectation now.
It
And once
does
again,
seem that
no
way.
judgment, but we grew up in a different time where it took months, before we even opened up that way. And even if that, there were taboo, it was considered taboo. But I do think, and that's one thing we do in session. We do some role playing, what it might look like if we're meeting someone for the first time, and you're feeling like you're really into them, but you definitely want to clarify and listen for, is that something that we're ready to explore? We have to have these conversations first. And yeah, you might get labeled a certain way for that. And once again, the people who are interested in you will stick around, and the people that don't, that's not your people, right? But I do see a sense of desperation. I think we're in a state in
Mm.
relationships right now where it's almost it's so scarce, that people will do whatever it takes to maintain whatever attention they can get. And therefore, in some ways, they've become more reckless and more giving and pleasing. And
Mm-hmm.
yeah, that's good in a committed relationship, but if you don't know a person, it can become very manipulative quickly,
Got
and
you.
very unhealthy. Um, so yeah, we do hope that the conversation can start even before we meet. But I think people have to decide too, when do I feel best to have this conversation? Like,
Mm-hmm.
Katina was saying, you cannot just walk up to a person and say that. But if you
Mm-mm.
really feel like this is a relationship that you want
Right.
to feed into, you want to go the distance with, set a time aside. Like, hey, I would love for us to meet, have a coffee date, have some things I would love to share with you about me.
Mm-hmm.
Um, and take it from there. But there's also ways we want to frame that so it doesn't look like I'm a nasty girl or nasty
Right, right.
guy. You want to talk a little bit about maybe the circumstances, if you want to
Mm-hmm.
share that, or
Mm-hmm.
how you have taken steps to
Okay.
manage
And I
that.
would think
Mm-hmm.
that would be the best starting point whenever they
Yeah.
decide to have the
Right.
conversation,
Mm-hmm.
is let me explain it to you
Yeah.
and let me tell you where I am. Because I
Mm-hmm.
think
Right.
that if you know your body, you
Right.
can discuss, if you've had any outbreaks, like you were saying, Dr.
Mm-hmm.
Katina, that there are some people that had that initial outbreak and never have another one.
Right.
You
And
know,
so for me, it's educating the person. So for a
Yeah.
person to come to me and they're having these struggles, but
mm-hmm.
they have a newer type of lifestyle, I would say what is your self-inventory? Let's
Mm.
talk about
Good
your
question.
experiences. Let's talk about severity of outbreaks. Let's talk about frequency of outbreaks.
Mm-hmm.
Let's talk
Mm-hmm.
about
Yeah.
comfort in using secondary protection. Let's
Mm-hmm.
talk about, and so with that, I know Janice had mentioned taking medications. So, do we have our toolbox ready, right?
Exactly.
Mm-hmm.
So how are we? Are you 50% of people have those prodromal sensations? What that means is
Mm.
before a lesion will pop up on them, they'll have a tingling, a itchy,
Mm-hmm.
a
Okay.
different sensation in that
Mm-hmm.
area, right? Do you have those warning signals?
Yeah.
That's a bonus,
Do you know what the warning
So,
signals are?
right. Well, those people who have these experience as a
Yeah.
woman,
Mm-hmm.
again, we talk about the fragile body parts.
Yeah.
It's very easy to notice, some tingling, some itching, a little burning, and those
Mm-hmm.
types of things.
Got
Okay.
you. Okay. Okay.
So doing a self-assessment of you and your experiences, I think
Mm-hmm.
that is important. Understanding when you should not be engaging, understanding, and that's one thing about because I don't think it's a larger population of people who are more spontaneous and engaging that needs to know about themselves than um, the ones that we're seeing coming into complaining. Even though we see it a lot, I still
Mm-hmm.
think the problem is this whole other subset
Mm-hmm. Mm-hmm.
that hopefully they're gonna see this, right?
Yeah.
Like I said, setting up what is their status? Are they taking a prophylactive?
Okay.
Don't be ashamed to ask your provider for a prophylactic. Even though I'm a mental health, well, I'll blur the lines because I'm a family nurse practitioner and a psych
Mm-hmm.
NP. So some things that someone will come to that a different mental health provider won't write a prescription for, I'd be like, oh, why not?
Yeah.
Sure, let's do
Yeah.
that. Sure, let's do Viagra. Sure, let's do.
Mm-hmm.
So I'm more apt to do more things. So yes, if they tell me about it, and they ask me for some valsiclovir, I don't think twice of it, and I
Okay.
provide the education.
Good. Good.
But I don't think that, but I would feel free to say, hey, just mention it to your provider. Well, all they're going to want to know is how often is it coming. You don't want to put somebody on a medication and they're literally they last had a breakout 3 years ago, but
Mm.
they just want to take it because they're stressed out about it, right?
Mm-hmm.
Oh,
So we
gotcha.
do
Okay.
talk about other things.
Mm-hmm.
Mm-hmm.
It really is. It sounds like a major educational process
Yeah. Yeah.
so that those that are diagnosed are very familiar with
Mm-hmm.
themselves. I know from the mental health side of things, one of the first things I encourage is, where are you? Let's assess where you are in this diagnosis so that we can figure out how you're processing it, so you're not actually leaning into all of the negative
Mhm.
statements and connotations
Yeah.
about being diagnosed. Nobody wakes up and decide I want to have
Exactly.
a STI. Not a
Mm-hmm.
person that I know of. But when it does happen, right? Because in my day and age, it was gonorrhea. Gonorrhea was running wild, but they could cure gonorrhea, right?
Yeah.
But these are different times, and
Yeah.
so being able to have someone to really honor themselves by
Mhm.
not being demeaning or negative self-talk. What would you all say to a client who has come in with a lot of this negative self-talk and really need to hear the educational side from medical and sexual activity? What are some things that you always say to encourage them that don't beat yourself up like that?
Yeah. So the first thing for me, and it always goes back to how we handle rejection. So, in sharing, you want to allow time for your partner to decide whether or not they will be comfortable moving forward with this.
Mm-hmm.
And through that, we're building skills where, you're not feeling so attached to it. Like, I can share that with you, but it's not to the point where if you tell me, well, you can't move forward, that I feel totally devastated. So developing a sort of freeing attitude to, I'm going to be honest, I'm going to share it. This might be a win, this might be a lose. It might be a deal breaker for one person, not a deal breaker for another person. So developing that mental flexibility and how we handle that, I think that is absolutely important. But another thing too is encouraging the client to set aside time to build on their strengths. And once again, your genitals are not the only thing that you bring that makes you an amazing person.
Right.
So how do we fuel these other parts of ourselves that makes us feel good, that makes us feel happy? And through therapy, we're going to be examining all of these other areas that we can pour into and allow people to pour into us, so we don't feel like you're totally worthless, because of this. And of course, we always recommend setting time aside to journal and think through positive things in yourself, right? Because it's, for some people, they isolate and therefore they're in the state of arousal. You mentioned, the trauma part of this in some of your questions, and some people stay there because they're isolated and they don't talk about it to anyone. You also mentioned in your questions about the African American community. And to be honest with you, that is a community I rarely see show up with that diagnosis. And that could be for various reasons. Perhaps they take care of it at the health centers, or they do what they need to do and they don't even want to talk about it in therapy because, once again, maybe some stigmas. So usually I see Caucasians, people from the African community, different countries, Indians. I see it, but I rarely see an African American come in who wants to talk about it. And it's so interesting when you shared that question. I was like, yeah, maybe once again, it's a stigma with therapy. They don't want to come in and talk about that or disclose that, or they have other ways of managing it, or, once again, social issues. Do people have health insurance? Do they not? Where do they go, to get, any type of insight on that? But those are the things I do. I really enjoy modeling and role playing in sessions. Because people are social, people want to go out, and if they don't know what to say or how to share this information, it's going to be really awkward and really hard. So we do a lot of role playing, like pretend I'm this guy, you're into me, you've seen me a few times, you want to have this conversation, and we might script it out. I might have them, use some of their personality, even humor, bringing into this conversation, so it doesn't feel as heavy. So that's the route I go with the negative self-talk, challenging that in the sessions.
That's pretty awesome. I definitely like the idea, and so I'm going to adapt that, the role playing idea. I do that with other things and using the empty chair process and things of that nature to address the trauma. And so, Dr. Catina, I know you still have so much information. What would be some things that you feel like we definitely need to know before this episode ends?
Okay. Yes. So the biggest thing, because like you said, this could go on and on. It is an interesting topic, and it is a fun topic,
It is.
But I would like to tell the young person that because you have an outbreak now does not mean that the person you're with gave it to you.
Very true.
That's what I would like to say.
And the thing is if you do have an outbreak, take care of yourself. Go get checked out. Become educated about what it means for you. Don't be afraid to talk to others about it. Here's the truth, and this is what I often tell my clients, regardless of any type of diagnosis, it's a diagnosis. It's not your identity.
Right.
Don't try to get dressed in the identity of, well, I have HSV. No, you're diagnosed with HSV. You don't have to wear, like Dr. Catina's favorite statement, I am not the poster child.
Yeah, I like that.
Right? So you don't have to get dressed in it. What you have to do is give yourself permission to enjoy life.
Yep.
You have to give yourself permission to become educated with a desire to really understand. Now, for all y'all out there that's going to be listening, take your little judgment hats off. Take them off. Because you don't have a right to judge. You just happen to escape that 1 in 4. That's the prevalence of it. If someone has to have a conversation and they need that safe space, try to be there without your judgment. Nobody needs to be a judge, because the individuals being diagnosed, they're judging themselves pretty hard anyway. So let's take that off.
And if they've only been with one person, because if you done been with 10 people, honey, you don't need to talk, because you
when
might
you
be
said
suspect
one
yourself.
person, 8 body counts, 4 opportunity, no, 2 opportunities. Listen, y'all, when you said that, I was just like, oh, good Lord, oh my. But the other thing Janice said is know your own status. Don't be afraid to go get tested. Dr. Catina said they don't often automatically test you for it. You have to ask for an STD panel.
But they don't test that in an STD panel.
Yeah.
Really?
Yeah. So you have to ask for a PCR. Yeah.
If you
Test.
have an active lesion, they will take take a
swab.
specimen from the active lesion. But as a panel, I feel good. Can you just test me? No, it is not tested. You have to literally go there in the first 2 days that you had a lesion to pop up, and them to swab it and send it for culture.
Got you. Okay, so thank you for educating me on that, because in my mind, it should be a part of the the panel with HIV.
It's not.
And gonorrhea and syphilis and all the other stuff that
and
comes
because it's complicated, that's why too. It once again, it's a complicated virus. You might have symptoms, you may not. It might be dormant. We don't know. So it does take
and the
additional
thing
steps.
that you all really want to understand about dormancy is, just like with HIV and any other virus, it could be dormant in your body from now to kingdom come.
Yeah.
And never have a breakout or anything. That doesn't mean that you shouldn't be aware of what's happening with your body.
For sure.
Become familiar with your body. Become familiar with, it's no different from checking your breast for deformed situations, or even a lot men listen. Let me talk directly to the men. Other than trying to put your penis somewhere, I need you to actually check your penis out. Look for deformities, right? Even your testicles, because contrary to popular belief, and most men don't realize this, men get testicular cancer, right? You need, the same way that women do mammograms, you need to be doing that with your testicles as well. You need to become sexually self-health aware of your body and what's happening. Cool, yes, sex is pleasurable. We enjoy it, the whole 9 yards, but you got to be sexually aware of what's going on with your body, so that you have the right to say, yes, right now it's not a good time for me.
Right.
And know that it's okay to, it won't make you look weak to tell a woman, no, not tonight.
Yeah.
Honor your body, honor yourself, and likewise, whoever your partner is, honor yourself in that partnership so that they can honor themselves as well. And that way, you all can maintain a wellness with sexual awareness, sexually transmitted viruses and diseases. Y'all, this has been great. I think we're going to do a part 2, because I know it's a whole lot more information that we need to get out. And ultimately, to the audience, we'll be bringing some lived experiences and things of that nature back out there. I know Dr. Catina and I are going to get together on 2 additional topics, HPV and vaginal prolapse. Honey, you might as well just be my resident guru.
That's a really good one.
Because I think that we need to have these conversations in our community. We have to have them. We've got to cancel out the taboo. the myths and
Mhm.
all of the foolishness that goes with it, especially the stigmas. Okay.
Yes.
Any last
Yeah.
words before we get out of here today, ladies?
So I wanted to share a resource. So I know back, I think in 2020, there was this lady online. She had a community group. It used to be called HSV in the city. I was just trying to look it up, but I cannot find it. I don't know if something happened with her or she just shut it down. But it was a great community where people will come together. It's like a support group. And I thought that was
Okay.
really amazing. There's also dating sites. So HSV Singles,
You
it's a
sent me
dating
that.
site. Mm-hmm.
And I passed
For
that actually on to several clients who are having
mm-hmm,
difficulties being
Finding.
diagnosed and dating. I
mm-hmm.
went on their website. That is so inviting.
Yeah,
Mm.
yeah.
Did you
So
know
those are
about that,
just some
Dr. Catina?
resources.
No.
Y'all making me grow up.
Yeah, well, that's why we need those interactions, right? But
Exactly.
yeah, HSV singles. So if you're having a hard time meeting people on the traditional apps and having to disclose that, of course, if you're on this site, we're already having these discussions, right? It might be second nature to say, hey, this is what I have, this is how it shows up. It might feel more comforting in that space. So yeah, just if I have any additional resources, I'll share them. But those are the two that come up for me right now.
Oh, I love that. Love that.
Mm-hmm.
Love that. So those are going to be actually in the credits on
Okay.
the podcast, as well as how you can get in contact with either Dr. Catina or Janice so that they can provide you with more insight. What's your last words, Dr. Catina?
No, I ain't got
Ain't got none. We done talked it out. We done talked it
Yeah.
out. We done talked it through. Our goal is to educate the audience. So like, share, and comment on this. Let us know how this podcast has really helped you, awakening you. I learned some things today, surely. And I'm hopeful that it will help others as well. So until next time on Authentically Peculiar with Marcia, we'll see you soon. Take good care.